Hello everyone. I've had several requests to discuss basically perimenopause and menopause and kind of how do these problems come about. And I want to include in that premenstrual syndrome. And as well as PMDD, premenstrual depressive disorder. So first, these are kind of hormonal the way they're discussed, because when you supplement with hormones, it can improve your symptoms. But let's talk about the hormones. So progesterone and estrogen, we know these are involved with reproduction, things of that sort, but they also both have effects within the central nervous system, within your brain. Both are associated with improved neurogenesis, so the development of new neurons, repair of neurons, and other kind of regenerative supportive elements within the central nervous system. So they're both kind of important to help your brain take care of itself. All right. Both have anti-inflammatory effects within the central nervous system, especially estrogen, it seems to be more so than progesterone. And then uniquely, progesterone has this ability to improve blood pressure in the brain. Now, whether that's from a systemic push of blood in the brain or the brain's own internal blood pressure regulatory system, we don't know, but clearly when you take progesterone, one of the most overt things it does in a patient is it'll boost blood pressure in their head. Now, the simplest case of this is PMS. Now, you may have seen in other videos of mine, I talk about this problem with low blood pressure in the brain, or what we call cerebral hypoperfusion. So low blood pressure in the brain, when you have low pressure, it's hard for the oxygen to jump from your red blood cells. So you breathe, you fill them up with oxygen. You got to push them up at the right pressure for that oxygen to flow into your brain. If you don't have enough pressure, it's hard for the oxygen to flow completely into the brain. So the brain won't function correctly. Now, when people get a brain injury, and this doesn't have to be a major thing, you don't have to be knocked unconscious. So simple head injury, something as mild as a soccer ball hitting you in the brain, in the head, will snap neurons in your brain, okay? Emotional trauma, inflammatory trauma. So inflammatory trauma, think of surgeries, pelvic hip fractures, big bone fractures, COVID, all right? The most common thing that people complain of is low blood pressure in their head, all right? And their complaints are brain fog, can't think right, tired a lot, headaches, neck tightness, generalized anxiety, feeling fidgety, panicky, all right, and moody. These are all symptoms that are directly or indirectly a consequence of low oxygen into the brain because of low pressure. Now, if you don't have systemic inflammation in your body, you get one of these injuries, within a few weeks, certainly by a few months, you'll be normal. Body will make it all recover. But that's not what's happening in the majority of people. Most of us are now being exposed to the inflammatory issues within coming from our food supply, our gut bacteria, damage to the vagus nerve, some other kind of side events like smoking, obesity, excess body fat, so forth, all cause inflammation. And so the brain can't repair itself correctly. Now, let's talk about PMS. So PMS, you think of this is basically low blood pressure to the head. Now, men, our blood pressure is regulated pretty much only by our autonomic nervous system. All right. Women, you get blood pressure, it's regulated by autonomic nervous system and your production of progesterone. Now, before you go into your menstrual window, as your progesterone levels start to decline, if you have a healthy autonomic nervous system, it'll increase the pressure in the brain to compensate, and your pressure remains normal. Okay? You won't have any of the PMS kind of typical symptoms. moody, hungry, tired, and so as progesterone drops, the autonomics will boost and increase, unless you have had an injury that you didn't recover from. Injuries are really common in life, and it's the fact that we are now not recovering. And if you're wondering if you have an injury to your autonomic nervous system, you go to my practice website. There's a little thing, take the ANS quiz, and it's basically a brain injury quiz. It'll tell you if you got problems. Okay, it's a simple little thing to do. But anyhow, so if you've had an injury you didn't recover from, what happens is your progesterone drops, and you aren't able to compensate. You aren't able to correct the pressure in the brain, and you get these low blood pressure symptoms until your progesterone comes back up after you go through the menstrual cycle. Okay? That's what PMS is. And if you want to look at some of the work, you can look at, there's a autonomic injury called POTS, postural orthostatic tachycardia syndrome, and look at that under progesterone, and you ought to find the literature talking about all this. It's being done by I think a group out of Japan. But anyhow, so that's the underlying thing. So PMS is a brain injury you didn't recover from because you got too much inflammation. All right. Now, there's another video I think I just put up that talks about you got to lower inflammation, get your brain to recover. So watch that. It'll go over a lot about the inflammatory stuff. Now, let's talk about perimenopause. Perimenopause is where you have this irregularity in both hormones, and so your predictability of menses is thrown off, and you start having symptoms and temperature regulation issues and things like that. It's basically the same thing. You're having at times low blood pressure in the brain because your autonomics can't recover, can't compensate. And with the fluctuations in estrogen, you have more inflammation in the brain. Okay, so the brain can't really take care of itself under these stressful circumstances. And that's why here, take some replacement hormones, you feel better. Okay? It's not that you're deficient in the hormones, because there's plenty of women that go through menopause, they don't have any symptoms. Okay? And they're still deficient. So it's not the de facto deficiency of the hormones that's causing it. It's that you have an underlying brain injury that these hormones were helping compensate for. Okay? And without, the injury can't maintain itself. The nervous system can't maintain proper blood pressure, oxygen delivery, inflammatory levels when you have these injuries. Okay? And then menopause is just kind of where the progesterone estrogens just stop. It's basically permanent PMS. Okay? And that's why you take these replacement hormones, you boost pressure up, and you feel better. Well, those replacement hormones can possibly trigger cancer and blood clots and stuff like that. Okay? So those are risky. All you got to do is focus on lowering the inflammation by looking at your food, gut bacteria, bouncing the gut bacteria, getting a vagal stimulator. If you have some things like bad gum disease is a big source of inflammation. Recurrent herpes, if you have 3 or 4 episodes of herpes a year, you need to be on suppressive herpes medicine, because that causes a huge amount of inflammatory stress. Actually, for each one episode of herpes outbreak that you have, you probably have 2 to 3 others that are asymptomatic where you won't know, but still causes a huge amount of inflammatory stress in the body. So suppressing herpes with acyclovir, things like that, getting off cigarettes, that doesn't help. Losing some weight, body fat's a big source of inflammation. I know that's not just, it's easy to do, but I'm just saying that's a big source. And so those are really kind of the major things. And again, watch that video I did on ways to lower the inflammation, and help me get focused on that. And so that's it. PMS, perimenopause, menopause are all the same thing. Now, one clue too I want to mention is so you get this perimenopause and menopause, a lot of flushing and stuff like that, and but if you have night sweats, so at nighttime, you almost have to change your gown or your t-shirt, whatever you're sleeping in, because you soak it. that's typically bacterial overgrowth. And 10 days of rifaximin, known as Xifaxan in the US, 10 days of that typically just goes right away. That's a clue. Okay? Watch my other videos on the symptoms that SIBO can cause and so forth. And anyhow, so I hope that helps kind of outline all that. We just got to lower inflammation, and these things will recover. If you're already on replacement hormones, it's fine to stay on those for a little while, get working on these other things, and you'll find you'll be able to come off of them and get rid of A, just taking pills, and B, get rid of the risk that those are associated with. So I hope that's helpful to everybody. Otherwise, have a great week. Take care.